Welcome to another episode of The Brand Called You, a podcast and podcast show that brings you leadership lessons, knowledge, experience, and wisdom from hundreds of successful individuals from around the world. I am your host, Ashutosh Garg, and today I'm delighted to welcome a very, very accomplished entrepreneur from the health business, a fellow YPOer from Kenya, Dr. Amit N Thakker. Amit, welcome to the show.
Thank you. Thank you, Ashutosh.
Amit is the chairman of Africa Health Business. He's the president of the Africa Healthcare Foundation. He's been recognized, felicitated, and awarded several times globally. And as I just mentioned, he's a fellow YPO member. So Amit, let's talk about Africa Health Business. Tell me about this venture.
Look, this venture started with the 25 years of experience I've had in the health sector. The main aim of setting up Africa Health Business in 2015 was to create a unit that propels investments and strengthens health systems in Africa. How we do this is through strong partnerships with the public sector and development partners to drive greater investments for healthcare and try to make a strong public-private partnership model. As you know, in Africa, 1.3 billion people depend on affordable, quality, and accessible health services. And this can only be possible when both public and private sector work together to enable this health system to reach all corners of Africa. So Africa Health Business is a boutique consultancy and investment firm headquartered in Nairobi and work around close to 27 countries in Africa.
Wow. So before I go any further, tell me a little bit about your journey before you started Africa Health Business.
So, I was born in Kenya. Having completed my education, I went to train as a doctor with the University of Nairobi, and then worked with my first internship year at the Kenyatta National Hospital, an 1,800-bedded hospital.
Wow.
That was the training ground. That was the beginning of my entrepreneurial journey. I realized during my training as a young doctor that affordable care was quite absent, and lots of people struggled paying hospital bills out of pocket, which they still do.
Correct.
I realized that there was a need for setting up a hospital and a clinic chain that will provide access to health services.
Right.
I launched Avenue Healthcare. So starting from one clinic, Avenue Healthcare became a household name and a brand across Kenya.
Wow.
With over 18 clinics and 3 hospitals, serving close to 50,000 patients a month. This enabled me to see the potential of reaching the unreached population, which could afford healthcare services. I started with a mobile van. I bought a van and converted that into a consulting couch and pharmacy attached to it. And instead of the corporate staff coming to the hospital, I started doing mobile medical services to factories, to large corporates. And that became a really good phenomenon in Nairobi, which was pretty new.
Wow.
And from there, I started developing in-house clinics, started serving agricultural farms, supermarket staff, and then needed to set up a base where all the staff could come and get services. So it became a managed care model from a mobile clinic. That was the beginning of the journey. It took me from 95 up to 2005, 2006, when I began looking at investors into our business. And through a private equity engagement, by 2010-11, we, as the shareholders, were able to exit that company. And that led to my exploring new ventures. And therefore, Africa Health Business came into formation.
Amazing. So, starting off with a van and building such a large enterprise, what would you say have been some of your learnings and some of your challenges?
So one of the things I learned about my entrepreneurial journey was the whole aspect of passion. I realized during my young days that providing care and enabling patients see the difference with good quality healthcare at affordable price was very key. And I was intended to make that difference. In making that difference, I was thrilled and joyed to see the solution I was able to give to people. So that really was the main learning I had, that the passion is pretty important. Finance is critical and it's important. The numbers must add up. But that wasn't the driving force at all. Okay. I remember not taking salaries for many, many months during the early days of the business. In fact, I realized I was even paying my own funds into supporting this journey. But the passion and commitment towards the goal of making healthcare reach closer to the people was the biggest learning I had. The second learning that I realized that enabled my journey to be successful was getting the right people. People who I studied with, people who I could relate with, people who I could work with. It became a joy every day to try and build a stronger healthcare system, to try and build a stronger avenue healthcare. And this moved from clinic to clinic. And that was actually not a task, but actually quite pleasurable.
Amazing.
Along the way, besides the learning, Ashutosh, you also talked about my challenges.
Yeah.
It's pretty clear that every day we would find lots and lots of people still unable to pay, whether it's a membership plan or an insurance plan or simply paying out of pocket for the services. We still have lots and lots and thousands of people in Africa who need healthcare services and are not able to pay. We started working out a subsidized model where we would help a large community that could not afford a subsidized price. We also went out to have free medical camps in areas and locations where there were certain disease outbreaks or certain conditions that we realized was increasing sickness. So contribution, CSR, philanthropy is also a major challenge. Finding enough finance for healthcare. It's not only enough to find more healthcare for the money, but we also need more money for healthcare in the continent.
Amazing, amazing. What an amazing journey you've had, and full marks to you. The way you've built this whole thing, despite keeping at the back of your mind affordable healthcare to Africans. Amazing. So moving on, Amit, when you look at the healthcare challenges that Africa faces, what would you say are some of the key areas that you have been focusing on?
So that's a very good question, Ashutosh. And I keep discussing with many of my peers and many of the global leaders. And when this question keeps coming, two main areas seem to feature quite prominently. One is leadership and the other is partnership.
Okay.
I've been seeing over the last decade a paradigm shift in leadership across the continent. And I'm delighted to let you know that we've got some sterling leaders in the ministries of health, at Africa CDC, Africa Union, and I can see a dramatic change in the way we are strengthening health systems in several countries. Let me use the pandemic as an example.
Right.
I mean, Africa is proud of what it has achieved.
Correct.
Look at what we averted. Not only did we prepare ourselves in advance, but we learned from the countries that were facing challenges and prepared ourselves.
Yeah.
We have been able to keep the entire infection down. We're now putting all the structures in place to increase the numbers of people who get vaccinated. And this is a display of a major shift in leadership that I mentioned to you about. The second one is about partnerships.
Right.
And here it's all about action-oriented partnerships. Partnerships that not only bring policies that are written, but actionable activities that will see results on the ground. We have seen development of homegrown African solutions, such as the Africa Medical Supplies Platform. We have seen other homegrown solutions that are known as AVAT, which is the Vaccine Trust that we had to layer on top of COVAX,
Mm-hmm.
we realized that these kind of action-oriented partnerships, and trust is a fundamental pillar in
Correct.
action-oriented partnerships. I'm beginning to see that it's no longer about them and us between public and private sector in healthcare. It's about working together. And that's the true element that builds action-oriented partnerships. So I want to re-emphasize that leadership and partnership is the secret formula in improving affordable, accessible, quality healthcare.
What a great response. What a great response. My follow-up question to that, Amit, is that for most people who don't know Africa very well,
yes,
we seem to look at Africa as one large continent, and we forget that there are multiple countries.
yes.
My question to you is,
yes,
how are the healthcare challenges being handled differently across different countries?
You're absolutely right. Look, in India, which serves a similar population, you have one legal system, one regulatory framework that enables you to provide health services across the whole country.
Correct.
In Africa, you need 55 licenses,
yes,
55 regulatory frameworks, and 55 dossiers or structures to make you reach that. So in itself, that's a challenge, right? It's not a country, it's a continent.
Correct.
And your question is around how do we deal with the challenges, right?
Absolutely.
How are different countries dealing with their health challenges in different ways? Each country tries to ensure that they have the best sort of health system on the resources that are allocated. I think the biggest challenge is the treasury. The treasury allocates a certain amount of funding towards the healthcare system.
Right.
And that funding enables them to then provide public health services. The Abuja Declaration talked about each country should allocate 15% of their budget towards healthcare. Now, we don't have enough money for healthcare in Africa.
Right.
So the biggest challenge is how best can we provide services with the meager resources that are present. Countries like South Africa, Morocco have a higher budget.
Correct.
So they are able to then develop a more sophisticated, advanced medical services and treatments. Whereas countries like Somalia or Sierra Leone will be considered to be fragile states or countries that have low budgets. So you're absolutely right. Every country has to make a bespoke plan on how they will use their own resources to provide healthcare to its citizens and reach out to the donor community, people like USAID, like the Japanese government, the German government, and the French government to supplement their budgets in order for them to produce the appropriate healthcare. Let me share one statistic with you, Ashu. In United States, an average expense is $10,000 per capita. That means that's what they spend on healthcare, $10,000 per person. In Europe, they spend close to $4,000 to $5,000 per person. You're right. In Africa, it's just below $100.
Wow.
Now, you can imagine with that big disparity, what would it mean when it comes to advanced treatments, the appropriate medications, advances in technology? It becomes extremely difficult. Hard choices have to be made. And each country right now is finding what's the best value for the money. And the other complication is that with some leadership in some countries being weak, you realize that there is leakage or inefficiencies in the system that now becomes a double whammy when it comes to providing healthcare for the citizens.
Fascinating. The other part, of course, Amit, is that, in 55 countries, there would definitely be a skewed kind of development that will take place.
Yes.
But how is technology changing healthcare in Africa?
Absolutely. I think the word I would use is it's the promise of leapfrogging into the newfound quality healthcare services using technology.
Right.
Africa is the best continent for the youthful population that adopts this technology,
Correct.
both as a community and a patient, and as the health service provider. Our average age is 19. We're the youngest region in the world. Being the youthful youngest region in the world, the adoption of new ideas and technologies has been rapid.
Absolutely.
Let me use an example of Kenya. Kenya provided to the world the most amazing mobile money platform. It's called M-Pesa.
Yep,
Not only was it the first, but was the most efficient.
Correct.
We've exported this kind of technology to the rest of the world, and they have adopted it now to enable people use this platform for ease of services. Many developed countries don't even have this platform. But with this platform on technology, it has transformed both the formal and informal economies of this country and the region.
Interesting.
Now, transposing that same success into healthcare, we are soon going to see that the whole telehealth, electronic medical records, telepharmacy, and telepathology is going to transform how people will get healthcare in their homestead rather than coming to the hospital doorstep. This not only will break the geographical barrier, but it will reduce costs of healthcare without compromising quality. And that's the promise for the next decade.
Wow.
I'm looking forward to Africa being the shining star in this model.
Fascinating. And yeah, the amazing thing is that you're at the forefront of all these changes taking place. But moving on, Amit, you and your team have been at the front line in handling the pandemic.
Right.
Help me understand, what did you do which were different to be able to protect and preserve so much of the challenges the pandemic has impacted the rest of the world?
Look, when we had the first case in Africa on 14th February 2020, it's just going to be 2 years. Early preparedness was the biggest secret.
Okay.
We had the fortune of watching how other countries were coping with it. We looked at how Italy was managing its cases. So by the month of March, at least half the countries in Africa were well prepared during the first few cases being discovered in the country. By April, May, and June, 80% of the African countries had experienced a case or two in the countries. What did we do? We created the COVID-19 strike team through Africa Healthcare Federation, which I chair.
Yeah.
We started exchanging blueprints, ideas, policies on how to protect health workers and how to ensure limited transmission takes place in order to save lives and livelihoods. This exchange of information was extremely powerful. It helped lots and lots of ministries of health. It also helped the private sector. And we promoted a task force in every country that was a combined effort of both public and private sector. So early preparedness, collaboration became the new innovation, and watching and learning from experiences globally were the mainstay of how we averted this becoming a disaster and an existential issue in Africa.
Very interesting.
I must say that we had challenges, Ashutosh. The supply chain was shut out. Movement of containers, cargo was extremely difficult.
Yeah.
And remember that 85% of the supplies we use in healthcare come from outside Africa.
Right.
we had to quickly transpose many of our industries to enable us protect our health workers. Garment factories started making PPEs. Those who were making masks started adopting to scale up their production. And within no time, we were able to supply all the protective gear for our health workers that had depended solely on imports to save their lives.
Amazing.
And that was remarkable. Some of the key things that we did together as public and private sector.
Absolutely. And, this is something Africa has spoken about in the world of the vaccines now, saying that it was quite an amazing response that all of you had in Africa to fighting this crazy pandemic. So, Amit, I'm now going to move to the last segment of our conversation. I have time for 2 or 3 questions for you. My next question to you is, if you were to look at life, and you've had an amazing life from a medical doctor to a very, very successful business person, what would you say are 3 key milestones in your life or your career?
I think my first milestone was my qualification, my engagement with the medical industry, qualifying as a doctor. That provided me the real grounded knowledge and support. The second milestone, I think, so far in my life has been the growth and expansion and working with new partners at Avenue Healthcare towards even financial institutions engagement. And my third milestone has been so far the outlook to Africa, which led me to start Africa Health Business as an entity. The third milestone is still work in progress. It's in infancy. We are just a 5-year-old institution. But these are the 3 key milestones in my career that have made me what I am and what I need to do in my lifetime.
Incredible. So my last question to you, and this is going to be heard by many, many, many young people. As an entrepreneur, Amit, what would your advice be to a young entrepreneur who's starting off on her or his journey?
All the best. I think it's a great time to be an entrepreneur. You have lots of people supporting startups. You have lots of funders. You have so many people with experience, probably much, much more than what I had 3 decades ago, where the funding was limited, partners were limited, experience was limited. You have a great environment to start your business. Just be mindful that the ecosystem that you surround yourself with is positive and brings you the encouragement. Don't let the naysayers and negativity weigh you down. Wow. Be optimistic as an entrepreneur and you'll find your space.
Amazing. And on that very, very positive note to young entrepreneurs, Amit, thank you so much for speaking to me. Thank you for talking to me about Africa Health Business, about health challenges and opportunities in Africa, about the amazing work that is happening across all the 55 countries, and how you and your team are playing such a pivotal or a central role in managing the pandemic and making sure that Africa gets the best possible healthcare and will keep growing better and better over the years. Thank you again and good luck.
Thank you, Ashutosh. It's been a pleasure having this conversation with you.
Thank you. Thank you for listening to the Brand Called You videocast and podcast, a platform that brings you knowledge, experience, and wisdom of hundreds of successful individuals from around the world. Do visit our website www.tbcy.in to watch and listen to the stories of many more individuals. You can also follow us on YouTube, Facebook, Instagram, and Twitter. Just search for the brand called you.